But most importantly, it's the financial instability in the hospital. As we all know, this is the hospital under the Church of Uganda, majorly aimed at providing the most affordable but high-quality services to people in West Nile region, mostly people who cannot afford the health services provided by expensive facilities. So because of that, the hospital ensures that the charges that are given to patients when they are treated is really affordable. And because of that, the collection of the money that the hospital gets, in other words, the income directly from the patients, is not sufficient to run the hospital. And therefore, for such a hospital to continue to exist, it needs support from different health partners. It needs support from the government. And the hospital has been getting support from the health partners. It was the health partners called BTC, Belgium Technical Corporation. That around 2016-2019, 2016-2017, it was replaced by Henabel. That has been majorly supporting the hospital financially. So these health partners, it has got its conditions. One of them, the recruitment of very many staffs, which is very good in order to provide the quality of services, and also subsidizing the service, the cost of service to 1/3 of what is meant for a particular services provided to a patient. And therefore, health providers, the partners, is supposed to pay, to top up what the patient should have given to the hospital. Now, in October 2018, up to date, the hospital has been without such support. And it is the reason which is why the hospital has not been able to meet its requirement in terms of payment of salaries and then the statutory obligations like the NSSF and PAYE. Now, because of that reason, there has been accumulation of salary arrears. The hospital has not been able to pay the staff regularly as it is required. Meanwhile, the hospital continued to follow the requirement by the health supporters, the Enabel, by providing treatment at a very subsidized cost. And that led the hospital into the current situation. So 2 weeks ago, from the 11th of May this year, a section of staff that became, actually, they lost hope because there was hope that we would get another health partners. Since when this other partner, Henabel, the contract ended, and they have not paid hospital for some money, some big sum of money, which we have been following it up to date. So the staff lost hope, complicated by the COVID-19, that these other health partners that were supposed to come, they have really delayed to come, and they are not seeing any hope anymore. So they lost hope, and then they laid down their tools because of the accumulated arrears. But the most important thing that the media and the general public need to know is that much as those problems are there, those are the institutional problems, that there are procedures, there are steps that are being undertaken to ensure that we sort out those problems. The hospital continues to run effectively. Currently, we have 90 staff that are running the hospital effectively, plus the volunteers. We have 5 doctors. Among the 5 doctors, we have specialist doctors, the physician. We have clinical officers on ground, the principal nursing officers, the nursing officers, the radiology departments. We have staffs in dental, and the services has been going on. So for the last 2 weeks, when some section of staff laid down their tools, services has been going on, except on concern with treatment of patients with leprosy, and then physiotherapy. This one's where when you have pain, they do some massage. It's only those 2 areas. But the rest of the departments, the administrations, OPD, inpatients, medical, surgical, theater, maternal and child health is ongoing. So for those 2 weeks, the most active department actually has been the area concerning with mother and child health, the MCH, where for the last 2 weeks, we had a total of 210 pregnant mothers came and received the services in the hospital. 472 children were immunized in the last 2 weeks, and 58 mothers or young women received the family planning. Very many emergency operations have been going on. In these 2 weeks, 33 pregnant mothers that were not able to deliver were delivered by cesarean section. And then other surgeries were conducted. In terms of the patients that walked into the hospital and go home alive, just in 4 days, the last 4 days from Monday to Thursday, maternity had 15 discharges, surgical ward had 9 discharges, pediatric ward had, that's children ward, 13 discharges, and medical ward, 5 discharges. How about the patients who were not able to save? In maternity, 100% of all mothers who came walked back home alive. There was no death. There was no mother who died during this time of the strike. The babies that were delivered, 100% of babies that were delivered did not die. So there was no death in maternity. In OPD, there was nobody who died. No one died. There was no one who died during operation. In theater, no death. Except in children ward that there were some 2 children who died in these 2 weeks. Most of the 2 were due to severe anemia. And then medical ward, 3 patients died. The 3 who died, most of them had organ failures, heart failures, and kidney failures. So the services is ongoing. The little bit of reduction in patients' attendance in the hospital, one of them is a complication of lockdown because there has been problem of transport to patients coming to the hospital, and also, of course, fear of coronavirus around. Of course, in Arua Referral Hospital is currently admitting many patients with the COVID-19, and Kuluva, actually, it is already on the pipeline, the next treatment center for patients with COVID-19. So it is the issue of COVID-19 and then the lockdown, which has reduced the number of patients coming to the hospital. But also, there has been some other informations flying over the radio which are not good about the hospital. And many of these informations were not correct. But the hospital is functional. The hospital has been providing specialized services. Among them includes orthopedic surgery in West Nile. Currently, it is Kuluva Hospital that provides specialized orthopedic surgeries. It is not going just because of the period of COVID-19. We have groups of visiting orthopedic surgeons, about 4 surgeons who comes every month and do specialized surgery in the areas of orthopedics, things to do with bone complication. We have a physician in the hospital, an Australian physician, who is on the ground up to the moment. Then we have visiting ophthalmic surgeon and ophthalmologist who comes and does a lot of cataract surgeries. I think all of us should be aware of this. When he comes, can do operation in 2-3 days, over 100 patients are operated. So Kuluva Hospital is functioning well. Our prayers is that with the different stakeholders, we need to offset these accumulated salary areas. I thank the Board of Governors and the diocese, the UPMB. They have made a lot of changes in the hospital in terms of administrative structures and then trying to instill the internal control within the hospital to ensure that there is proper accountability of the resources within the hospital. Thank you very much.
Kuluva, we've been silent because what came on board was like a storm, a big storm. on us as a church and in Kuluva Hospital. But we have ever said Jesus is in the center of this storm. And the Bible reveals that God's deep desire for all human beings is that they be healed of all that they go through, be it physical, be it emotional, and be it spiritual. Kuluva Hospital is committed not only to treat the physical part, but treats emotional, the physical, and the spiritual. That's why we have the doctors in place, we have the counselors in place. We also have 2 chaplains there in place to provide quality service that Madi West Nile diocese desires to achieve. Kuluva Hospital is a private non-profit hospital owned by registered trustees of Church of Uganda, which is only placed in Madi West Nile diocese. All the 37 bishops of the province of Church of Uganda actually have a fair and any issue on this hospital. That's why they're the trustees. Bishop of Madi West Nile diocese cannot make any decision alone. So it is these trustees. The hospital is located in Madi West Nile diocese, 9 kilometers along Arua-Kampala highway, in a village of Kuluva, Vura sub-county, Arua district, West Nile region, in northern Uganda. The hospital was founded by William Brothers in 1942 as a clinic for treating people affected by leprosy, eye patients who were marginalized in West Nile region. In 1951, it was registered as a general hospital and has grown to a bed capacity of 210 as recorded here. We work in partnership with the Ministry of Health, and it gets annual support from the government as a grade 4 hospital and seconded as a treatment center to manage COVID-19 cases in Arua district. Apart from Arua Regional Referral Hospital, it came to our notice on 11th May 2020 that some staff went on strike as recorded and echoed by the hospital director. But I wouldn't like to now dilute what he has said. As a diocese, we are committed. We work through structures. We have the synod, we have the council, we have the board, we have the management team. So we've been waiting for those channels to follow its course. And rightly, the DS will give you now the update of exactly what has transpired apart from what the director has said. I want to wish the people outside there and the media houses that Kuluva is still alive. The hospital is doing well. We serve people up to DRC, Southern Sudan, Nebi Diocese, and people are coming and the hospital is going on as we look at spiritual, physical, and emotional healing. I beg to stop here. I thank you for listening to me. This can take over.
So far, the steps that have been taken to address these issues include: 1, the bishop has had meetings with the civic and political leadership in Arua district, namely the LC5 chairman, the RDC, and the area MP for Vura, who is also the Honorable Minister of State for Finance, General Duties. And this, they had a chat and they had way forwards on how these issues can be addressed. The bishop and the team were also able to meet the aggrieved parties on the 22nd of May under the leadership of the LC5 chairman, and the RDC was also present, in which discussions were made among the aggrieved staff and also the management and the board of Kuluva Hospital. In general, the findings that we noted are that, one, there has been communication gap between the staff, the management, the board, and also the diocese. Two, the revenue base in Kuluva is very low. As noted by the director, they mainly rely on user fees, which cannot evenly match the expenditure of the institution. Three, one of the major partners to the hospital, that is Annabelle, when their contract ended with the hospital, the management still kept hoping that they will renew their contract, but it kept also the large number of staff wishing that things will normalize. As such, this left a very big financial gap in the institution as far as wage bills are concerned. Due to the low revenue, the staff had to go into salary arrears for 6 months. The payment of the salaries has been ongoing. This is mainly to offset arrears. For instance, October salary was paid on 8th of April to around 142 staff, leaving out the management or senior staff. Then on the 12th of May, all the staff were paid for the month of November 2019. This means that at least they have been getting something, but which has been to clear the outstanding salaries. We also noted that there were irregularities which arose, and these issues are being handled by Office of the DPP. The decisions taken: one, the diocese, under the leadership of the bishop, has instituted a team of very competent people, which is a 5-man committee, to do a special investigation within a period of 1 month, and their findings will be presented to the bishop, and this will be used to take decisions. And we believe the synod will also be there to take decisions on this. The bishop has also written letters, one to the Archbishop of the province of the Church of Uganda, to share and discuss the issues concerning Kuluva Hospital. They have also written a letter to the Minister of Health as far as the issues in Kuluva Hospital are concerned. And our brother, the MP for Vora, was spearheading the following up of the letter with the Minister of Health. We have resolved, together with the board and management of the hospital, to look for funds to offset the arrears, to which we want to ask the staff to give us time to sort out this, since it's a large amount which we may not be able to get in one day. Our mandate as a church is spiritual development. We stand together with all the parties concerned to pray with them, to seek for divine intervention. We know that in all this, unless the peace of mind which comes from the Lord sets on you, the situations may not be easy. It's our interest that we will also continue to pray together with these parties. We seek for peace, for unity, reconciliation, and love. In conclusion, it's unfortunate that the staff of Kuluva had to endure all these challenges of working, yet being paid intermittently, for which we want to apologize and seek for their forgiveness. We are concerned for our institutions. No parent wants to see his or her child die or collapse, and that is also our heart's desire. All these institutions of the church have an eye of the bishop. Since the bishop cannot be in all these institutions as the chairperson for the board, we shall step up the aspect of monitoring and supervision in all these institutions, be it the health facilities or the educational facilities. We want to empower our heads of departments to see that they are able to see and oversee what is happening in these institutions so that there is compliance. Thank you for listening. May God bless you.
Adamant who laid down their tools up to now were about 70. They are now about 70. On 11th, they were around 92, but now they're about 70. So when we went, we wanted to meet the staff. Actually, we had earlier sent management to meet the staff on 7th. They could not meet. The board went there on 11th. They still could not meet us. On 12th, we were there. They could not meet us because their conditions were, they needed all their arrears paid. They wanted all the West Nile MPs to be around, the RDC, the bishop, LC5, and so on before they could meet us. So, as others continued working, others were adamant to work under the prevailing circumstances. So as the board, we gave them 1 day to register, wanted to know who are willing to work and who are not willing to work because we couldn't meet their conditions, as they said before they could start work. Indeed, some registered to continue working and they continued working, and then these other 72 put down their tools and they have not worked. So the board had to sit down. We looked at our human resource manual. We thought we should give them, the best option we had was to give them leave without pay and indefinite, because the concrete decision on such needs to be made in a full board with the consultation of the diocese and other stakeholders. So as the executive committee that time, the best thing we could do was to give the staff leave without pay. And we told them to stay within the quarters, within the hospital, and not go to the clinical areas because they were psychologically anguished because of the arrears. That time it was 6 months, but as we talk now, the arrears has reduced to 5 months. As the bishop said, we are looking for money all over the place to make sure that these arrears are settled. Why the arrears came, as they said, it is because of liquidity stress. The user fees in Kuluva are so low. I can give you an example. All major operations, cesarean section, laparotomies, and all other major operations are at only 150,000. I think that is the cheapest rate in the whole world. OPD for children is 10,000, flat rate. Adults is 15,000, also flat rate. These rates were increased a bit even from when Annabelle left. By Annabelle time, the rates were lower than that. After they left, we tried to increase it a bit, but also mindful of the community that surrounds Kuluva. We could not increase it all of a sudden. We had to do it step by step. So the issue of staff who are on leave without pay, now that the diocese has brought a commission of inquiry of about 5 people to come and find out what is happening in the hospital, we will wait for the outcome of that inquiry. Then we'll also, the full board that time will now sit and understand what happened and review the situation case by case. Otherwise, as board, we really welcome the team with both hands. They are most welcome. We have a lot to share with them as the management. A lot has been said on media. I think it's an opportunity to find out the truth. And all those who have issues, whistleblowing and so on, I think this is the right time to come up with those issues. Let them feed that team with all the information they have, so that when they come, we're able to answer them and the truth comes out. About the mismanagement that you are asking, the hospital had an administrator called, I think, Ondoma Sam? Oh, sorry, Ondoma Jimmy. You will have to correct that because there's another Ondoma Sam who is a board member. So the administrator was called Ondoma Jimmy. During his time, there were a lot of mismanagement issues, which came out in the internal audit of IDI. And then there was also an internal audit constituted by the board. It was conducted by UPMB. So the issues which were raised, we gave him a fair hearing. The ones he explained clearly were removed. The ones he could not explain with his team, they were handed over to the police to investigate. The file was worked upon. Because it's a corruption issue, the office of DPP in Arua, together with the police, thought it should be handled by the Anti-Corruption Court in Kampala. So the file was taken to the DPP office in Kampala. The file stayed there for some time. It came back just towards the lockdown. They wanted some few clarifications to be done. Then the file will be resubmitted to Kampala. So as the processes are taking place, we cannot hurry it. We shall submit the file. I reported the case myself after the investigation. One board member had to be a complainant, so I went to police myself. So we are hoping that if the file goes back, they will sanction it and the law will take its course. So on that, the issue of when the DS talks about DPP's office, that is the process that is taking place right now. The cars which were sold, the board's directive was that because there were so many old cars, very, very old cars on the compound, we wanted to sell all of them and replace them with one relatively new car. That was the directive of the board. But as time went on, these cars were sold. The management, under the same administrator, decided to divert that money to pay salaries, I think.
Now the referral is actually in both directions. Even Arua Referral Hospital refers patients to Kuluva Hospital. The reason sometimes is that the patient has come when they have already used everything in theater and they have not been able to sterilize them. Sometimes there is no power. So the regional referral hospital can refer patients to us. And sometimes it is the same reason why we do that. But sometimes we also refer for some specialized service because of the level of the medical personnel that can be there. So that one is normal. It moves in any direction.
Is there any debt that...
Yes, I'm on it. About the debts, yes, we talked of the accumulated salary area, the NSSF, but there are other debts, most of them with the service providers, in particularly the providers that are providing drugs. We have some debts with joint medical stores, and then other private pharmacy, the healthcare plus. As you realize from the communication from the diocesan secretary, that the hospital is supported by government. The government sends some little money to the hospital. The money is majorly to be used for two purposes. One is the procurement of the drugs, and then the second one is the other primary healthcare activities like immunizations and family planning. So if you realize that the little money that the government sends is for buying drugs, those drugs are not enough. So sometimes the drugs is procured, which is done every quarter after 3 months. And if some drugs get finished in 2 weeks, we will have to buy. So if it occurs at a time when we do not have money, as an institution, it is not that you must have cash for you to get the what you want to buy. So some of them we have not been able to pay in time. So there are other debts with the service providers.
But we still look towards God for the final solution, because He's the author of life and He's the author of this hospital. He's present in this turmoil, which I call it as a storm. Remember, the issue of Kuluva have been over-exaggerated. I want to say that Satan asked God to fight Job, and God allowed it. But God asked Satan not to destroy the life of Job, but Job was tempted. I take this as an opportunity, as a church, we take it positively. And therefore, Kuluva Hospital, we want to say is still alive. It is a hospital. It is not a clinic. It is a hospital which is very, very thriving. The challenges it is going through is an ordinary challenge which other institutions are going through. But this has come at a time when God wants to refine the hospital. We want to thank the hospital management for the sacrifices they are making to help our people in this region. We thank them dearly. Even the Bog, whom they are painting, are sacrificing. Some of them are using their personal money to do this work and even contribute to the hospital to offset some of the bills for which they allegedly say they are embezzling funds. But our 5-team committee will prove the public and prove to the world whether these are true stories or not. I want to thank them dearly. We don't pay the Bog as a diocese. It is a voluntary work. It is a sacrificial work. It is a church work, which is without any payment. We only pray for them, and they have accepted to work, and we pray for them that the Lord will watch over them during this difficult moment. I want to thank the media for giving information to the public. You know, information is power. It can either destroy or it can build. But I pray that whatever information you give out should be to build our nation, to build our region, and to build our institutions. I pray that the Lord will make you to filter all the information you receive as you give out information to people. I thank God for Kuluva Hospital and for those William brothers who established it, and it still stands, and we pray that it will stand. My appeal to the public is, if you are sick, please visit Kuluva Hospital. And all the stakeholders, I appeal to us to humble ourselves together with Christians. Let's repent where we have erred, and let us ask for God's forgiveness and God's intervention. And with this, God will put Kuluva back to its normal glory. I thank you for listening. It's my prayer that as you go back to your respective stations,